So the amount of tape you need for this taping technique is very, very effective, I found from my experience. So you grab the tape about halfway, the length of your shin, across the knee, and about halfway up your leg there. So I'll show you where it goes, but we need that much length here. I'll be cutting that off. Then I need another one exactly the same size. So I just cut that off. Then always round the edges, because the edges is what makes it comes off fast. So I round the edge. So it becomes that. So I've got two pieces of equal length here. So this taping technique is very, very effective for any ACL tear, especially grade 1. Also grade 3s, the full ruptures as well. If you're waiting for surgery, some people don't want to get surgery with ACL tears. This can be very, very supportive of a knee that doesn't have an ACL. And the ACL is one of the primary pillars of ligaments inside the knee, and it stops the femur and the tibia here, stops the femur from moving forward in relation to the tibia, especially when you're running and you go to stop. If there's no ACL, the tibia tends to keep moving. You feel there's this shear, so it can lead to degeneration of the knee much faster. So this technique, it gives support with the hamstrings and then support across the knee to control rotation of the knee and that forward translation as well. People who have had meniscal injuries, both acute or chronic, I've found that they like this one a lot because it controls that rotation so much too. So what it is, we've got about this much of the tape, this middle part, will have about 95 to 100% full tension on it, and the rest of it has got long anchors of no tension at all, okay? If you pull a lot of tension on with short anchors, it just pulls off really fast. So the long anchors is to ensure that it gives the support to the muscles and the fascia and the joint, but that middle part has got a lot of tension to control the rotation. So what I'm doing, to peel it, I fold the edge this way, then I can just peel it down like that. So I'm peeling off quite a bit. Then I'm going on the hamstring tendon, just here. So go right on the hamstring tendon, no tension at all. And then I'm starting to curl it around, and I turn my shin in, so my foot in as much as I can. Then I pull 100% tension from here across the knee. And then I've got no tension there. And I just pat that down. The other one goes on the outer, so there's two main heads of the hamstrings. So it's always easier if someone else to do it for you, but you can do it yourself. So I'm going on the tendon on the outer edge here. No tension till I get to the knee. Then I'm turning the knee out as far as I can. Pulling that 100% tension across. Then no tension here. Just pat that down. The adhesive in the tape is heat activated, so rubbing it helps it stick, and also body heat helps it stick. This taping can stay on as long as, leave it on as long as it stays on, as long as it doesn't irritate your skin. If you get irritation, usually within the first hour it starts to happen, so you just take it off. And the tape you can leave on for, usually get 2 days out of it, but often you get 4, 5, even 7 days out of it too. So you can wear it when you're sweating, and then when you're showering, just pat it dry. It's designed to stay on with those type of conditions. And then you just get up and walk. Does that feel more supported? Another taping you can do to support this ACL one, you just measure from one side of the knee to the other. Cut that off. Fold the ends up so you round the edges off, because the edges come off fast. And the knee's just off lock. If you find it hard to relax your knee, because we want the kneecap to better move here. If you find the knee hard to relax in this position, lay your leg on a table or a couple of chairs, but pop a rolled up towel underneath or a pillow, just so your knee's in a bit more of a, it's not totally locked out is the idea. Then I'm rolling that edge, peeling off that edge to get it off. About one inch. So I'm going from the side. And I'm pulling up till there's about 1 inch worth of tape on the backing here. Pull that about 75 to 95% tension. Push the kneecap aside, so you're pushing it across a little bit. Anchor that down and then slide that on. So there's no tension here, no tension here, about 75 to 95% tension here. So it's gliding the kneecap that way a little bit, which gives a support for rotation in the knee. For some people with osteoarthritic knees or meniscal knees, just doing this bit of stripping here, they find it so relieving and helpful.